my instructor made me wash my hands like 40 times that day and put on sterile gloves because I didn't do it right. And so she's just like, you know, well, you didn't do this, or it was like some little tiny picky little thing that I hadn't done exactly the way she wanted it to do it. And I remember coming home, and I think I called my mom and said, I'm not going back, you know, fuck this. You know, I am not doing this. Just like, you know, Teresa, it's just one instructor, it's just one person. How long is that class? That class is like, you know, it's just like 2 months, and then you don't have to deal with her again. And you cannot allow someone like that to stop you from doing what it is that you want to do. So your life is always going to have obstacles, and there are always going to be people who aren't nice. So what? You know, do you know who you are? You know, are they damaged? Is the system damaged? But that doesn't make you damaged. You know, so the system can be abusive, but it doesn't make you an abuser. And so rise yourself, take yourself above it. And I just said to myself, you know, it's 3 months. You got to put up with this person for 3 months. I can put up with anybody for 3 months. And at the end, because after that, they mean nothing to me. They mean nothing to me. I take what they have to give me, and I move on. I utilize that. And I just dealt with it. And I came to residency. I was a National Health Service Corps scholar. I took a scholarship in medical school. I would say that my first job in my course spot was when I really, I think, realized and thought to myself, what the hell have I gotten myself into? So now I work at the VA. Right? Why did you leave that idyllic situation? Anyway, so now I work at the VA, and my patients, if I hear people's story, and I've heard the physicians over the course of the weekend talk about their wounds, and I have to say, I feel like we need to be writing a book about PTSD and the commonality between the experience of people who are in the military and people who are in medicine, because what I can say is that it's so much the same. They are the walking wounded. You can't see their wounds. They look good from the outside. They look strong from the outside. They're soldiers, and they are so broken. And I feel like there's so many people in our profession who are broken, who have been broken by the hazing, broken by the system, broken by someone telling you you've got to see one more patient, 25, 26, 28, 30, 35 patients in a day. How can you connect with someone if that's what you really came here to do, to be the advocate, to be connected, to be a healer? You cannot connect with 35 people in one day. It is impossible. And so you put on the armor, not the armor of the Christ, not the armor of love. You put on the armor of self-protection, and you close yourself down, and you do your job. And your patients are unhappy, and you're unhappy. And that's where we are now. And our profession needs a healing. And I think that's what this experience of being here at Brighton Bush has really been, that opportunity to be a witness to our colleagues suffering, and it allows us to tap in at a deeper level to our own suffering, and maybe to really recognize for the first time that, yeah, you were strong and you made it through it, but that doesn't mean that it didn't hurt you.